Okay, so this is actually a really good question. I'm going to split my answer up into three different parts. So first and foremost, I noticed that you said PT/Kegels, and I just want to reiterate that if you're going to see a pelvic floor therapist, they're going to be either a pelvic floor PT or a pelvic floor OT. In the realm of pelvic health, it doesn't really matter which one you go to. What's going to matter more is if you vibe well with them or feel like that person is going to be a good fit for you. And it's kind of like seeing an MD or a DO, right? They're both physicians, but the lens that they use to treat people, DO and MD, is going to be different. So just choose somebody that you resonate well with. Number two, so pelvic floor therapy is different than Kegels, right? So Kegels are just one isometric contraction of your pelvic floor. Going to see a pelvic floor therapist who's going to evaluate and assess you is going to be a lot different. So not only are we looking at your pelvic floor, but we're also looking at your posture, your rib cage, your activities of daily living, lifestyle habits, hydration. And then on top of that, then we're also going to be assessing your pelvic floor. And then when it comes to your pelvic floor, we might do an internal assessment where we assess your strength, coordination, and your endurance of those muscles. Now, depending on these results, we'll then prescribe you some exercises to do to target those deficits that you have. Now, pregnancy does cause a lot of changes to our core and pelvic floor. So for instance, your pelvic floor actually stretches 2 to 3 times its normal size. Just because those changes happen doesn't mean that you have an inability to rehab them. So think about an athlete that has an ACL tear, right? Or sprains a bicep. Just because the injury is done doesn't mean that you can't rehab it. And the same goes for your pelvic floor. So yes, injury has been done to these muscles after birth, but they are very much rehabable, if that makes sense. It's like any other muscle or tendon or anything in your body, right? It's definitely treatable. And pelvic floor therapy is not a one size fits all. Just because you're dealing with leakage might not be the same reason somebody else is also dealing with leakage. There's also different types of leakage. There's stress urinary incontinence, and then there's also urge incontinence. So 2 different types of incontinence that you could be dealing with. In terms of length of pelvic floor therapy, that's also going to depend on your deficits and your lifestyle and your habits, your roles, your routines. There's so much that goes into it, but there is a lot of nuance to pelvic floor therapy. And again, like I mentioned, it's not a one size fits all. The treatment for every single person is going to be a lot different. I hope you found this helpful, and I hope it answers your question.